Have you been suffering from shoulder pain, or are you unable to lift or move your arm due to pain in your shoulder? Well, today we're going to discuss a few different common causes of shoulder pain and how we manage shoulder pain both in the office and at home. The shoulder is made up of three bones: the upper arm bone or humerus, the scapula or shoulder blade, and the clavicle or collarbone. There are two main joints to consider when talking about the shoulder: the glenohumeral joint and the acromioclavicular or AC joint. The largest joint of the shoulder is the glenohumeral joint, where the humerus or upper arm bone sits in a shallow socket of the shoulder blade. The smaller joint is the acromioclavicular or AC joint, which is the connection of the collarbone to a portion of the shoulder blade called the acromion. From here on out, when talking about the glenohumeral joint, I will call it the shoulder joint, and the acromioclavicular joint will be the AC joint. Tendinitis is inflammation of the tendons, which connect the muscles to the bones, as you can see here. Most of the time, tendinitis of the shoulder is going to be associated with the tendon of the rotator cuff muscles. The rotator cuff is made up of four different muscles: the supraspinatus muscle, the infraspinatus muscle, the teres minor, and a muscle you can't really see here, the subscap muscle, which is shown over here. These muscles are largely responsible for our ability to rotate our arm or shoulder, as well as lift our arm and assist with other movements by stabilizing the shoulder. Bursitis is inflammation of the bursa, which is a lubricating sac that sits between the muscles and a bone on top of your shoulder, as shown here. The bursa allows the tendons of the rotator cuff to glide freely when you move your arm. Impingement syndrome is due to inflammation of either the bursa or the tendon of the supraspinatus muscle, shown here, which sits on top of the shoulder and runs underneath the AC joint. The inflammation reduces the space for the tendon and bursa underneath the AC joint, which can cause pressure or rubbing when you raise your arm to or above shoulder level. Shoulder neuropathy occurs when one or more superficial nerves become sensitized, causing pain and sometimes numbness, tingling, or a burning sensation. There are a few superficial nerves in the shoulder that can cause shoulder pain. The dorsal scapular nerve runs between the shoulder blade and the spine on each side. The suprascapular nerve runs above the collarbone and into the front of the shoulder. The axillary nerve runs right out in the back of the shoulder and arm, right near the armpit, and feeds the back of the shoulder and the back of the upper arm. And then the medial and lateral pectoral nerves come underneath the collarbone and serve right in here, right underneath the collarbone and into the chest and pectoral muscle region. The shoulder is the most open joint in the body, meaning it has the most range of motion, and the muscles and ligaments are basically holding the shoulder together. This means that injury and inflammation to the muscles is, one, very common, and two, can be the cause of common types of shoulder pain. I want to note that there are other reasons one could have shoulder pain, such as frozen shoulder or an injury to the labrum, that we're not discussing today. But now that we do have an understanding of some of the common reasons for shoulder pain, we can move on to the in-office assessment.